Welcome to our discussion on cystic fibrosis, a genetic disease that affects millions of people worldwide. Cystic fibrosis is a chronic and progressive disorder that impacts the lungs, digestive system, and many other organs. Its effects cause a thick, sticky mucus buildup in various parts of the body, particularly the lungs, leading to difficulties breathing, infections, as well as digestive issues. While significant progress has been made in managing cystic fibrosis, there is currently no cure. However, with proper treatment, many people with CF can live longer, happier, healthier lives. Today, we will be exploring the causes, symptoms, as well as management of cystic fibrosis. Cystic fibrosis is a mutation of the gene called CTFR, which stands for cystic fibrosis transmembrane conductance regulator. This gene is responsible for encoding proteins that help regulate the movement of salt and water in and out of the cells in various organs, for example, the lungs and pancreas. When the CTF gene is inherited, the protein doesn't work properly. This causes a disruption in the balance of salt and water in and out of the cells. This leading to a big, sticky mucus buildup, which is extremely difficult to clear out, causing blockages in the airways, organs, or other serious health problems. Some symptoms of cystic fibrosis can vary person to person, but some common physical traits include chronic coughing, wheezing, and frequent lung infections. These occur because the mucus building up in the airways, causing difficulties breathing as well as other problems. People with cystic fibrosis often experience poor growth, malnutrition, as well as frequent diarrhea, as the mucus blocks the enzymes from getting to the intestines that are needed to break down the food. Although there is no cure for cystic fibrosis, this disease is manageable with treatment. Treatment options include CTFR modulators, which are medications designed to improve functions of the defective CTFR protein, Other treatment includes enzyme replacements to help digestion, antibiotics to treat the infections, and therapies like physio-chest therapy to help clear up mucus from the lungs. Regular exercises and healthy diet are also important for managing CF. However, some treatments can come at a risk, and some side effects. For example, CTFR modulators can be expensive and may have side effects like liver problems. Cystic fibrosis is common amongst Caucasian people, particularly those of Northern European descent. It affects about 1 in every 2,500 to 3,500 live births in the US. It's less common in people of Asian or African descent. Living with cystic fibrosis can have significant emotional, social, and financial impacts. People with CF often face challenges in life like frequent hospitalization, medical bills, and emotional stress, as well as families and individuals may also experience mental health problems as well as struggles to deal with the ongoing nature of the disease. Fun fact, this is an autosomal recessive gene, which means its genetic pattern where two copies of a mutated gene, one from each parent, are required for an individual to express a particular trait or disorder. If both parents are carriers, there is a 25% chance with each pregnancy that their child will inherit the condition. This mode of inheritance is common in various genetic disorders, such as cystic fibrosis. Cystic fibrosis is typically diagnosed through a sweat chloride test, which measures the amount of salt in a person's sweat. People with CF typically have higher amounts of salt in their sweat. Additionally, genetic testing can confirm the presence of a mutation in the CTFR gene, but in many countries, newborn screening is a part of the routine checkups. This helps identify the cystic fibrosis early. In conclusion, cystic fibrosis is a serious genetic disorder with significant impacts on the lungs, digestive system, and overall quality of life. While there is no cure, advancements in treatments have improved the outlook of people living with CF.